genders and orientation of folks can experience painful entry. That's true. And we know that painful sexual activity is linked to PTSD, not just sexual trauma, but any kind of trauma. And we also know that it's important to appreciate the intersectional identities, or what Lucy Fielding calls the identity constellation of our clients. And so anatomical terms in this presentation will be inclusive of all genders, but not exhaustive in terms of the desired terminology of our clients. And so we'll often ask folks, what would you like your parts to be called in our time together? Because everybody has slightly different names for what their parts are. And so for this presentation, orientation, opening, and object of penetration should not be assumed, and it shouldn't be assumed with clients either. All right, so we're going to move forward with some definitions. When we're talking about painful entry, you often hear the words dyspareunia and anodyspareunia, which historically means pain in the vaginal opening or pain in the anal opening. And so we know that encounters with all healthcare professionals are unfortunately from a primarily cis and heteronormative lens, and so is the research. So research into dyspareunia is primarily focused on cisgender women in heterosexual relationships. Anodyspareunia is primarily studied in cisgender gay men. And so more folks than these study groups experience these problems. But from the research, we know that there's painful sexual intercourse in up to 41% of reproductive age cisgender women. And in a Belgian study where they found among gay men, 68% engaged in anal receptive intercourse, and 59% of those folks had pain. We know that trans-masked folks on testosterone report up to a 70% incidence of abdominal pelvic pain, and half of the time that occurs with sexual activity. We also know that dyspareunia is common in up to 75% of folks after a gender-affirming vaginoplasty. And so for this presentation, very broadly defined, what we're talking about here is painful entry in any genital opening during sexual activity. So this photo here is from a trip I took to Peru, where in Lima, there is a Larco museum of pre-Incan art and artifacts, and they have an entire erotic pottery gallery. So this is all erotic pottery that I took pictures of, and I'm so happy to have a place to use it. I knew this would be the crowd. I was like, oh, I'm giving this presentation, I can take these photos, this is fantastic. So some of these friends will make appearances in our presentation today. So what we hear a lot from our clients when they come in with these symptoms are reports of burning, tearing, stabbing, blinding pain even, maybe a muscle spasm. It might occur with all sexual activities or only certain sexual activities. It can be superficial or deep, and there's often significant distress associated here. And when it comes to diagnoses, check out this amazing vulva pot. Like, how cool is that? So we're talking like, 14th century, by the way. So amazing. So the diagnoses that we're going to see are vaginismus or anismus, which usually refers to that involuntary muscle spasm, either in the vagina front opening or in the anus. Vulvodynia, which just means pain in the vulva. Dyspareunia and anodyspareunia. And so for my therapists in the room, also want to say that we know that all of these have now been lumped together in the DSM, of course, as genital pelvic pain penetration disorder. We do not see that diagnosis in our clinics, but diagnosis matters less for us than the treatment of the individual person in front of us. And so classic vaginismus and that muscle spasm usually requires a significantly different treatment than folks with dyspareunia from other causes. But that's why we do a comprehensive exam, and we're going to take you through some of the ways that we do that here. We also want to note that it is not only folks with vaginismus who habitually avoid sexual activity. So we're going to try to really individualize our treatment approaches to every person.